Okay, so this is a LASEK. It's also called the alcohol-assisted PRK. It's a more advanced way to do a PRK, so it doesn't hurt. It was invented at Harvard by myself and two other physicians, John Talamo and Juan Carlos Abad. So this is the dilute alcohol solution. It's inside this well, the metal ring that you see. And this is just a little sponge that we're using to soak it up. I'm tree finding now, so I'm just rotating the edge of the ring to get like a little edge. So then I'm just using some BSS balanced salt solution to irrigate away excess alcohol. It's a little bit toxic for the eye. And now I'm going to use it's called a hockey stick, or it's like a spatula. It's not sharp, okay? So we're just pushing aside the skin of the eye. And the goal in the end is to get smooth borders, so as much as possible. You can see some of these borders on the left are going to be pretty good, and then on the right they're not exactly perfect, but still it's much better than a regular PRK. We're just scraping off the epithelium and not having smooth borders. You can also see that the skin of the eye is coming out. It's like coming off really easily, and it's because the alcohol solution delaminates the epithelium, which is just a fancy way of saying it separates the epithelium from the underlying corneal stroma. And we have to do this because otherwise when you laser, some of the laser energy is going to be wasted vaporizing and evaporating the skin of the eye, which would just grow back, so you wouldn't get the full prescription removed. So now you can see there's like little pieces of epithelium, so I'm just using a Wexel sponge. It's a brand name for the cellulose sponge to clean up the eye. And then you're going to see I'm going to center the laser and start the procedure. So you can see a well done LASIK or alcohol assisted PRK is much quicker recovery and much less pain and less chance of scarring than a regular PRK, just because it's a cleaner edges and it heals quicker. I've done like, I don't know, 20,000 of these, 20,000 eyes. So, you know, if you go to a LASIK doctor, I'm sure you could do a PRK, but it's not going to be that great. And just like these days, if I tried to do a LASIK, I stopped doing that 10 years ago, it wouldn't be so great. So if you want to save for a procedure, you have to not cut the flap, and then you might as well go to some surgeon who basically specializes in the non-cutting procedure. This is just the laser, and you can see the blue light is the fluorescence on the cornea, and that's part of the cornea getting vaporized. And when you have this done, you're going to smell something that's burning hair. It's not burning, it's not a thermal process. It's a photoablative process that was invented at Columbia when I was actually at medical school there by Stephen Turkel and Francis Lesperance. They're the two doctors who invented the excimer laser, and they're actually the doctors who trained me and certified me on the laser. This is almost 30 years ago. Okay, that's pretty much it.